Jared and Jacob from Marble City Pharmacy joining us this morning on Health Monday. Gentlemen, good morning to you.
Good morning.
You got smiles on your face. You big Auburn
Yes.
Tiger fans and happy with the 2-0 start to the season.
We have to take the wins anywhere we can get them.
There you go.
Yeah, they
There you
count for something.
That's
But
right.
before we get to our topic this morning, you guys are somewhat distraught too about the lady who was killed down there, and y'all know that area very well.
It's a really common area for people to go run in, even single women, as she did. So she would go run at this place, I'm sure, and think nothing of it, as a lot of females do. But you know, I just told my wife, these young girls, we got to tell them, you can't go anywhere like that by yourself. You just can't.
Absolutely, absolutely. Wow. Macular degeneration. I practiced saying that.
Nailed it. Nailed it.
I can't say it 10 times in a row.
That's okay. That's okay. We'll take the one.
Yeah. First of all, Jared, what is this?
Yeah, you go ahead. I've already talked a lot. I feel pretty guilty.
Yeah, man, I'm tired of hearing you.
Yeah.
Okay. Macular degeneration. It is an eye condition. You know, there's parts of the eye that we know the lens and the iris, and somebody says that, okay, that's part of the eye. We don't know much about the macula. Nobody out there knows. If I said, where's the macula? Nobody knows. But the macula is part of the retina of the eye. It's a small part of the retina of the eye that's in charge of your central vision, straight on, not peripheral. Your straight on vision, your macula is in charge of that. Macular degeneration is just that. It's degeneration or breakdown of the macula. There's a couple of different types. There's dry macular degeneration. I said it wrong too. Macular degeneration. There's dry, which is what everyone that gets it starts with. And then in some of the people, about 20%, it progresses to wet macular degeneration. And we'll talk more about those two in a minute. But it can be one eye or both eye. And the main thing it causes is blurred vision right in the middle. I mean, if you're picturing looking at me right now, just put a blur right over my face, but nothing else. Everything else is clear. Just right in the middle is the main distinguishing factor of macular degeneration.
Jake, is this common?
It is very common, extremely common in people over 50. It increases every year from 50 on up, so very, very common.
All right, Rose. Jared, what about some of the symptoms that one might suffer or begin to tell that they might have this issue?
Yeah, he talked about some of it, you know, right there in the central line of vision. It doesn't necessarily affect peripheral vision. That's why we don't talk about total blindness when we talk about macular degeneration. So, but central vision, you sometimes have distortions. Things don't look like they're supposed to look, basically. You'll have a much more difficult time concentrating on fine details, right? Some people with macular degeneration have trouble even recognizing people's faces. Our grandmother got to that point at one point in her life. Sometimes you have a blind spot. You guys think about maybe in your car when you're there's always a blind spot in the car, right? Something's in the way. You can't see when somebody's in the other lane. Well, in macular degeneration, you can have this just all day, every day. And so things that you can't see. Sometimes you know you have it because you need brighter light. And so you think maybe this brighter light will help and help and help and help, and sometimes it doesn't even do the job.
Besides affecting older Americans, what causes this, Jay?
Well, the most common form, again, the less severe, more common form, dry macular degeneration, we don't really know beyond aging. But then, you know, not everybody gets it. Some people age and don't get it. Some people age and do get it. And just to be quite honest, there's not a definite answer for dry macular degeneration. There are some genetic causes, we think. We know that smoking, obesity, you know, bad diet, these things make you more likely to have it than less. But we don't know a specific reason for the dry that is the most common. But of the 20% or so of those that progress to wet, we know exactly what happens there. And that is you get this irregular growth or leakage or increase of blood vessels back around the retina in the eye, and they leak fluid into the back of the eye, which takes those people who already have dry macular degeneration and make it significantly worse, really rapidly progressing. So we know what causes those. It's leaking blood vessels, basically.
Male, female, black, white, who gets this?
Yeah, good question. Well, he covered one of the main ones, and that is, first of all, it's mainly people over 50. One of the things we haven't talked about as far as race goes, this is more common in white people. One of the biggest things is that this does have a hereditary component to it. So if somebody in your family has this, you are more likely to have it yourself. one of the single things you can control most is it's much more common in people who smoke. So we can sit here and give you 50,000 reasons not to smoke. Here's another one. Way more common in people who smoke.
Why?
I don't know the answer
a great
to that.
question.
But smoking, nicotine does have an effect on the blood vessels. So I think it's some relation there. I think you might have mentioned this just a second ago, but they can't exactly put a correlation between these, but it does seem like it's more common in people who are obese, and it is more common in people who have cardiovascular disease. So when we start to think about prevention, those are some things we can focus on there.
Okay, well, can it be prevented, and how can it be prevented?
A lot of this, we were talking about this, on the way here this morning. A lot of this, his list of all these risk factors and who gets it kind of plays right into how to prevent it, because you don't do something directly for your eyes to prevent it. There's no, well, let me use the eye drop to prevent it. No, it's, well, if cardiovascular disease causes it, I need to manage my high blood pressure. I need to take my medicine. I need to take my heart disease medicine. I need to, keep my diabetes in control. I need to not smoke. I need to not smoke. I need to.
Shouldn't spoke either.
You shouldn't smoke either.
Some people say you don't need to speak at all.
They're correct for me. You need to maintain a healthy weight. You need to exercise. All of these things that are just general health factors. Because again, when we went back to what causes it, all we really had was we know there's correlations between all these generally unhealthy things without knowing exactly why. So what I can do to prevent it then is all these things that we know are generally healthy, taking care of our medical conditions, taking care of our body, not smoking, eating right. And if there's one thing that's specific, it's omega-3 fatty acids, fish oils. Eating a lot of fish or taking a fish oil supplement we know is very preventative for macular degeneration.
If you're just thinking about it, Jared, about losing one of your eyesight, one of your eyes, you can't see out of, or is distorted or whatever, and that can put a real crimp in your style. How can this be treated if that's an issue?
Well, it's interesting you say that because as we get older, I didn't start wearing glasses until maybe I was in my 30s or so. But as we get older, I think we all expect changes in our vision and to get worse, glasses, contacts, that sort of thing, normal part of aging. This is when you get to a little bit more scary place because now all of a sudden you can't recognize somebody possibly if it gets really severe, or you got something in your line of vision. That obviously it's a serious problem. So as far as treatment goes, when you start talking about the more common, less severe form, the dry macular degeneration, the really one thing inside the four walls of our pharmacy is actually an over-the-counter medication. It's a vitamin that you guys, some of you may have heard of. It's called the AREDS or the AREDS 2 formula, AREDS. That's just an acronym for a study they did one time. It shows all these particular vitamins help with eye problems. You guys may have heard of lutein or zeaxanthin. Those are some of the main ones that they looked at in these eye problems. So that's really the only treatment for the less severe form. There are things that they can be done in the doctor's office. Sometimes they will basically try to retrain you on how to see. I find this very interesting with this problem. So almost like a relearning how to see. I don't understand how that works. There are certain procedures or surgeries that you can have and hopefully a way to correct it, but I'm not sure of the success rate of those. When you progress to the more severe form, the wet macular degeneration, and this is something that I don't really want to think about, but the main treatment for that are actually injections into the eye.
Ouch.
And injections into the eye. Our grandmother had these on a very regular basis for years and years and years and years. You have to do those every 4 to 6 weeks to kind of help maintain the treatment or the effectiveness of the medication. And again, there are other types of surgeries that they can do when you have the more severe form, but if you have the less severe form, there's a certain kind of vitamin. If you have the more severe form, certain kind of injection you have to get from the eye doctor.
I guess, Jake, if it gets too severe, it can affect you driving, working.
Well, that's what, we think about, oh yeah, eye problems, that's normal. But like you said a minute ago, what if starting tomorrow, you can't drive yourself anymore? Well, okay, then you don't drive yourself to work. You don't drive yourself to church. You don't drive yourself to Walmart. Life changes 100%. When those eyes start to go, if it's not something treatable or preventable. And so that's why we start early and start often, being healthy, watching what you eat, being very cognizant of, hey, I'm starting to see things a little different. Okay, well, don't tell your eye doctor 7 months from now or a year from now. tell your eye doctor now, because they catch it now. You take some vitamins, you prevent the progression, no big deal. And so we just encourage people so much in this. Eye stuff is a huge deal because it affects everything you do. Just take care of yourself and pay attention to how your eyes are doing, report anything weird, and a lot of this can be avoided.
Yeah. All right, guys, thanks for coming this morning. Appreciate it.
Yes, sir.
All right.
All right, we got more coming up. Appreciate you joining us today. Going to be a nice day weather-wise. Take a look at that, and I'll see you tomorrow morning.